So, first let me just thank DG Cleo and also Takeshi. And thanks to all of you for being here. Thanks to all of you online that are joining us, etc. It's really an honor to be here with all of you today. My thanks and a shout out to the Nutrition International team for all the hard work that they've done to get us to this point as well. This is a very timely conversation. Given the state of the world right now, in terms of the shocks to the development ecosystem, the retreat of traditional donors, and the increasing fiscal pressure that countries are facing, this is also a moment to recognize the untapped potential of multilateral development banks in the fight against malnutrition. Now, I'm especially pleased to be here alongside my colleague and friend, Cleo Kawawaki, as well as Takeshi, because we met each other in Paris earlier this year at the Nutrition for Growth Summit. And that's where the ADB and Nutrition International launched a 7-year cooperation agreement to strengthen nutrition security across Asia. Less than 2 months after that, the ADB announced plans to increase their support for food and nutrition security by $26 billion. And so there's a lot of good things are coming together here. And this is a moment not only to imagine what's possible, but to find new ways and creative ways together to tackle malnutrition in the region and to challenge one another to turn that vision into reality. So today I'd like to share and explore 3 main ideas with all of you. The first is that malnutrition in the Asia-Pacific region is seriously undermining the bank's mission to reduce poverty, build resilience, and drive inclusive, sustainable growth. And the second is that financing nutrition should not be seen as a cost, but as one of the smartest investments we can make. And the third is that malnutrition is a solvable problem. And the ADB, working with partners like Nutrition International, has a critical role to play. Now, for those of you less familiar with our work, Nutrition International is a global nutrition organization headquartered and created by Canada. We impact over 60 countries around the world, working with governments in Asia and Africa. There are some of our cumulative results so far. A bit of feedback there. And for more than 30 years, we've been serving as a bridge from evidence to action at scale in nutrition by combining in-depth technical assistance, research, governance support, and operational capability to improve nutrition and health, especially for women, adolescent girls, and children. But the main question in front of all of us today is, why should nutrition be at the heart of development efforts in the Asia-Pacific region? I'd like to start by talking about young people. So in order to achieve their full potential, to succeed in life and make full contributions to their countries, all young people have to have access to 2 critical things: a strong immune system and a fully developed brain. And without good nutrition, neither of those is possible. So in a world where malnutrition is preventable, every malnourished child represents a missed opportunity of immense proportions. We see the direct impacts in health, most certainly, but it also destroys human capital and it fuels inequity in societies. And this is dangerous because inequity undermines social cohesion and it creates instability. And that's the last thing we want in the region, right? So let's look at how this works. First off, in health. The health impacts fall most heavily on women, particularly mothers, adolescent girls, and children. Simply speaking, malnourished mothers create malnourished babies, right? And malnutrition not only puts the woman at risk, but a child born to a malnourished mother is much more likely to be born too soon or too small. Now, these small and vulnerable newborns have a much higher risk of dying and are predisposed to becoming stunted and wasted. They also have much higher risks later in life of becoming overweight, obese, and developing non-communicable diseases. So you can see already this pattern of prevention is starting to emerge in terms of the benefits of investing in nutrition. Now, my health right now is directly related to the health and nutrition of my mother when she was pregnant with me. That's the same for all of us here, right? So Mom, if you're listening, because I'm sure you signed up for this webinar, thank you. That's yet another reason to be grateful to our mothers, but it's also really important that we focus on their health because they hold an important key to ending malnutrition and to ending the intergenerational transfer of poverty, because that's what malnutrition does. For adolescent girls, When we're able to tackle the very high anemia burdens they have, they're healthier, they're better able to stay in school and succeed there, and this gives them better opportunities once they graduate. You know, DG Cleo talked about the importance of gender. That is a solid through line through this discussion. So there are significant gender components and labor market participation aspects that we need to pay attention to here that impact poverty and inclusive growth. And as for children, almost half of the 5 million children that die every year from preventable causes have malnutrition as the primary contributing factor. And if you ask me, the correct number of children dying from preventable causes should be 0. And so prioritizing maternal and child nutrition is one of the ways we can get there more quickly. Let's double click on this human capital damage dimension of malnutrition. So education. This is one of my favorite pictures. I just showed VP Fatima this picture in a meeting right before this. It's a brain scan of 2 3-month-old children from Bangladesh, where the one on the left is a stunted child and the one on the right is a well-nourished child. And it just indicates the impact of malnutrition on the brain formation, on the formation and connection of neurons, the neuronal infrastructure of children. Because if a child is born to a malnourished mother and doesn't receive the right nutrition in the first 1,000 days of life, their brain development will be irreversibly compromised and they'll never reach their full potential. This is the picture I show to ministers when I'm in different countries, where the penny really drops. Because up until this point, a lot of times people consider nutrition as one option among many, rather than intimately connected to the success of all. And that's one of the main points that I'm trying to put across, I think, today to all of you. The brain grows so fast in the beginning of your life that it's already 80% of the weight of an adult brain by the time a child is 3 years old. So if you miss that cognitive development window, you miss it for life. So no matter how many schools we build or books we buy or teachers we train, if that child is cognitively damaged before they get through the front door of a school, they will struggle to learn, they'll have a higher chance of dropping out, they'll get lower paying jobs, and they'll miss out on realizing their full potential. According to the World Bank, children that are stunted are up to 33% less likely to escape poverty as adults. Yeah. And they earn significantly less over their lifetimes. So that old saying is true. Stunted children today lead to stunted economies tomorrow. Let's talk about stability for a moment. There's no better image of unequal opportunity in a country than a stunted child standing next to a well-nourished one. In this graphic, both children are exactly the same age, right? It's just one of them is stunted. The odds are stacked against that stunted child from the beginning. There's also no better ingredient in the recipe for instability and conflict than an entire cohort of young people who realize they're falling behind, who struggle to catch up, and who have nothing really to gain by protecting the status quo. We look around at the world today, and the penalty that we pay when societies are unstable wipes out development gains that have been hard-earned for decades. And this is why an investment in nutrition isn't just an investment in health, but also an investment in education outcomes, in economic growth, and in building equitable and stable societies. It is so much cheaper to prevent and tackle malnutrition head-on than to allow it to continue. But let's bring that all back to the Asia-Pacific region now. So despite decades of real progress in the fight against malnutrition, the Asia-Pacific region still faces significant headwinds. The triple burden of undernutrition, diet-driven overweight, obesity and non-communicable disease, and micronutrient deficiency continues to cause significant damage and is acting as a brake on regional economic development. Let's unpack that using some of the latest statistics. So the most recent joint child malnutrition estimates from UNICEF, WHO, and the World Bank show that 76 million children under 5 in Asia are stunted. That's 51% of the global total. In South Asia, almost 40% of children are stunted. In Southeast Asia, it's 1 out of every 4 children. These are not small numbers. Nearly 30 million children under 5 are wasted or too underweight for their height. No other region faces a burden this severe, and most of the children live in South Asia. Nearly half of all women and girls in South Asia are affected by anemia, and it is a major yet preventable problem. It's a massive health penalty for women and girls that translates directly into reduced energy, productivity, and opportunity. At the same time, this clear and present danger and rising threat of overweight, obesity, and non-communicable disease, driven by unhealthy diets, is undermining progress as well. Nearly half of all children under 5 are affected by overweight in the Asia-Pacific region. That's more than 16 million children. That doesn't even include adolescents. We'll come to that later. But that's the largest number of overweight children under 5 in any region of the world and rising. The health cost implication of that is catastrophic. Oh, okay. Here we go. Is that better? I think for this room it's fine. It may be for the people online. Alrighty. So we already know that well-nourished children are healthier and better equipped to learn, to get better jobs, to have higher income, pay more tax, and increase their country's ability to contribute domestic resources towards essential services like quality education and improved health care. In this way, if you think about it, investing in nutrition creates a virtuous cycle between health, human capital, and economic development. But there's a vicious cycle here too that we have to call out. The rise of diet-driven NCDs like diabetes, hypertension, heart disease, and cancer, major killers in the region, risks bankrupting already limited health budgets by forcing them to spend more on treating these conditions than on preventing people from getting sick in the first place. Our healthcare systems are becoming sick care systems. We have got to get back to prevention, and that's what investing in nutrition can do. Household incomes are also paying the price of malnutrition. You know, across this region, particularly in low and lower middle income countries, out-of-pocket expenditure accounts for almost half of healthcare costs. The private sector is losing too. When workers are stunted as children, companies lose profits. A 2022 Lancet article estimates more than $80 billion in lost sales every year across Asia. And when workers themselves are struggling with malnutrition, think for a moment about women and adolescent girls who might work in textile industries where there are very high anemia rates. You know, low energy, more sick days, lost income, and lost productivity go hand in hand. So in terms of economic damage, malnutrition impacts individuals, household incomes, increases costs and constrains government budgets, it hits companies' bottom lines, and the compound losses impact country and regional economic growth. So this is not a small issue. And that's why investing in nutrition is one of the smartest investments that governments and development banks like ADB can make. As DG Cleo said, every dollar invested in nutrition yields up to $23 in return. Show me a better investment than that. And so before we get into some specific examples and ideas about what countries, partners, and the ADB can do, I wanted to share a reflection about how our fight against malnutrition is evolving at Nutrition International. You know, in the past, we were very focused on scaling up the lowest cost, highest impact, most evidence-based interventions that vulnerable people were not getting access to because we knew that would have impact. And that's good. So we were really focused on doing more of the good in nutrition. But the food environment people are in, especially in this region, is being flooded by ultra-processed food high in sugar, salt, and fat, as well as sugar-sweetened beverages. And sales and profits and marketing are highest for these unhealthy products in areas with the least regulation. Now, there's a lot of good that can be done in the policy, regulatory, and tax space. Products that harm us should be heavily taxed. Children should be protected from marketing of unhealthy food products. Consumers should be educated about the nutritional quality of the food they're buying. These are all things that we can do, all things that we should have done yesterday in a way, but areas where the ADB can have significant positive influence. Just as one anecdote, did you know that the same infant cereal product sold by a Swiss multinational in Thailand has 6 grams of sugar per serving, but when the same product is sold in European countries, it has 0? Asia and Africa are full of these kinds of lopsided examples where we can actually correct and protect for children. But we wonder why the number of overweight children is growing, right? Even closer to home, right here in Manila, a UNICEF study recently looked at more than 1,000 online posts and videos from 20 of the most popular food and beverage brands. What did they find? 99% of that marketing would not be permitted for children under World Health Organization guidelines. 99%. So think about what children are seeing every day on their social media feeds, in their environments, in advertising. They are being converted to being customers and consumers of ultra-processed food and sugar-sweetened beverages that will ultimately make them sick and force the health systems to subsidize, right? So that's why our task is twofold. I'm kind of expanding the chessboard for us here. We not only have to prioritize and scale up good nutrition, we've got to protect the food environment and the people in it through regulation, taxation, and programs and policies that reduce the consumption of unhealthy foods that are driving malnutrition. More of the good and less of the bad. So how do we do that specifically? You know, the first thing we've got to do is make sure we're not missing any opportunities to integrate nutrition into other investments where it makes sense. Making nutrition-smart social sector investments across health, agriculture, social protection, water and sanitation, and education is a great place to start. And the Asian Development Bank is uniquely positioned to do just that. And frankly, we are energized when we see examples start to come out of the region for all of this. Aha, the famous Paris photographs. That proves it happened. So we've already seen some encouraging examples from the Asian Development Bank, and I just want to give you examples of two. Earlier this year, the bank approved a major social protection initiative in the Philippines with nutrition explicitly embedded as a subsector. The project's going to help households gain access to affordable, nutritious foods while also strengthening national systems and capacity. In Lao PDR, a watershed management project of all things, deliberately built in community nutrition outcomes, supporting women's empowerment and promoting diversified production and improving household nutrition awareness. In my dream world, there's a systematic analysis of every project in the pipeline where we ask the question, could it affect nutrition outcomes? Yes, no. At least we've got to start asking. So building nutrition into individual lending operations is good, but the scale of the need and the opportunities in front of us are bigger. Not just to add nutrition in the margins, but also to shine a brighter and more systematic light on nutrition itself because it supercharges everything else. The bank has already recognized health and nutrition as a pillar of its food system transformation agenda. That really matters. That's important. Because nutrition should not only be seen as something cross-cutting, it deserves specific focus, and with clear strategies, targets, and resources. At the same time, this is about developing that no missed opportunities approach, looking across the bank's full toolbox, programs, policy, and financing, and asking, how can every investment contribute to better nutrition outcomes in the region? Here are a couple of examples, I'm just making them up, of what building a strong, nutrition-smart social sector lending portfolio might look like in practice if it were more systematic. So when health projects include improving maternal nutrition, reducing anemia, and focusing on newborns, not only do fewer women die, but more healthy children are born, and the lifetime economic benefits are locked in from the beginning. When social protection programs increase access to fortified foods alongside cash transfers, or they're used for nutrition screening and referral, families don't just get income support. Their nutrition security improves, and their access to services increases. And if you come to education, investments, when they focus on getting children ready for school is good, but when education investments focus on getting children ready for school, not just getting schools ready for children, when they provide nutrition education and anemia control programs to support adolescent health, more girls stay in school. Children learn about healthy diets, learning outcomes improve, and the next generation enters the workforce better prepared to succeed. If you come to water and sanitation, when those projects are paired with deworming, hygiene, and menstrual health, infections are prevented. Children absorb more nutrients from the food they eat already, and adolescent girls are able to keep going to school with dignity and with care. And when agriculture strengthens not only production, but nutritional quality and women's empowerment, diets diversify. Families get more of the vitamins and minerals that they need, not just calories. And rural economies grow healthier and stronger at the same time. So having a nutrition-smart social sector lending portfolio is going to make every ADB dollar go further, with every project delivering a double win, achieving its core goal and at the same time building human capital. And with the ADB's size and influence, the net effect would be significant for the region. That's why it's so critical to embed nutrition into country partnership strategies. These strategies are the compass that send a signal to ministries of finance and planning about what matters and where resources should flow. So if nutrition is missing from these foundational strategies, it stays on the margins as an afterthought. But when we build it in from the beginning, it becomes part of the long-term financing plan. It becomes visible, measurable, predictable, and it sends a powerful message that nutrition is not just a nice to have, it's a must-have for achieving country and ADB objectives. Just to make a point, I don't want to pick on ADB too much. I just want to say it isn't just about what the bank can do alone, right? It's very much about how it can learn and how it can lead. And I believe the ADB has the potential to lead other multilateral development banks in this regard, right? Sharing with them and learning from other banks while also ensuring that lessons, evidence, and innovations flow rapidly across its own member countries. Nutrition International is ready to help as part of our 7-year cooperation agreement by distilling best practices into transferable tools, by facilitating structured dialogues between different banks, and by helping governments and bank teams adopt proven models rather than reinventing the wheel in isolation. You know, action and progress in nutrition don't happen by accident. They happen when the right ingredients, the right combination of capabilities, and the right partnerships come together. I want to share a little bit of insider baseball in terms of Nutrition International and how we're approaching things in terms of our own equation of change. So first, we know that change starts at the top, when political will is strong. So our role is also to contribute to supporting governments to build that leadership by providing policy advice, strengthening institutions, and creating the conditions where ministers of finance and planning see nutrition as central to their development agendas. Second, we know that leaders need data-driven, costed policy options that help them make the case for nutrition and understand the trade-offs and the benefits of investment. That's why we created a health economics unit at Nutrition International, and that's why we built the cost of inaction tool, which shows, for example, that anemia, low birth weight, and stunting alone costs Asia an estimated $346 billion every year in health expenses, lost productivity, and reduced growth. And we can map that out for every country in the region so their decision makers can understand the economics of malnutrition and the benefits of investment. Third, we know malnutrition crosses multiple sectors, so we help bring different sector ministries together to create mechanisms for joint accountability and coordinated action. So nutrition is not fragmented, but embedded in national systems. And fourth, we bring the supply and the demand side of nutrition financing together by engaging development banks directly to reinforce their knowledge and capability in nutrition, and by working shoulder to shoulder with countries to build bankable, scale-ready plans that development banks can finance. Our role at Nutrition International is to help connect the dots, bringing technical expertise, operational capacity, and 3 decades of in-country experience and relationships as a trusted nutrition partner. We help governments and development banks move from evidence to policy to implementation at scale. And no institution is better placed than the Asian Development Bank to pull those ingredients together and drive progress across the region. And that's how we stop treating nutrition as a side issue and start treating it as one of Asia's smartest, highest return investments. Now, as I wrap up my remarks, I would like to run a small thought experiment with all of you. This is part of our internal strategy process we run sometimes called the time machine exercise. So imagine all of us get into a time machine and we travel together to 2030, and things have gone extraordinarily well. The ADB has become the undisputed champion for nutrition. Everything has gone better than we had hoped. What kind of things, when we stepped out of that time machine, would we see? How would we describe that world? So here are some examples to spark our imagination. So the ADB's success at connecting sectors, achieving higher returns, and taking creative approaches to financing nutrition-smart social sector lending portfolio will crowd in additional funding from donors because they see the results, the leadership, and the impact, and this will help expand ADB's lending portfolio. All countries in the region will have high taxes on unhealthy foods and sugar-sweetened beverages. This will reduce consumption and raise additional revenue that will be reinvested in maternal and child nutrition and things like large-scale food fortification, creating a double win and putting the initiative back on prevention. The ADB will use an ambitious set of policy-based loans to protect food environments across the region. In exchange for financing and technical support, countries will put in place policies on front-of-package labeling and consumer education. They will ban the marketing of unhealthy products to children and incentivize the production and distribution of fruit, vegetables, and other nutritious foods. Millions fewer children will be stunted and wasted, anemia rates will fall, and learning outcomes will improve. Stable economies will grow even faster. That's just part of the dream, right? It's good to dream. It's important for us to dream. It gives us something to aim for. So let's aim for dreams like that. In conclusion, just to say, the future of the Asia-Pacific region will not be determined in boardrooms or budget lines or in speeches like this. It will be determined in the minds and the bodies of Asia's children. If we do everything in our power to make sure they are well-nourished and healthy, Asia will be unstoppable. I'd like to thank each of you and the people joining us online for your patience in listening to this long speech, and I'm particularly grateful to our partners at the ADB for your leadership and commitment to an Asia-Pacific region free from malnutrition. We are proud to stand with you and to work towards that end. Thank you very much.